feces on the floor. His Foley was half out, and there was...
Hi, I'm a registered nurse and I work in medical surgical units and also in intensive care units. In situations where patients are pulling on things and disrupting their care, we do ask for restraints. But there are multiple things that we do before we even ask the doctor for restraints. We try and de-escalate the patient ourselves. We ask other coworkers to come because sometimes a new face can be refreshing and maybe they'll listen to that new person. Sometimes we call family members to get them on the phone or ask them to come in to help de-escalate the patient. We'll give them a PRN medication if they do have one ordered to help them calm down, because a lot of times people are very anxious when they're in the hospital. But if all those things do not work, we need restraints. Sometimes we ask for mitts, but in my experience, mitts are not really that effective. A lot of people bite off the mitts with their mouth, or they take their teeth and rip off the Velcro and then put the mitt between their legs and pull their hand out. So soft restraints are usually needed after they get out of the mitt restraints. So the nurse was asking for restraints during that time to make sure that the patient doesn't pull out the Foley, maybe their IV line, or any other tubes that the patient has inside of them. Technically, the patient is a danger to himself at this point in our eyes because he's disrupting his care. So having the restraints in place can make the patient have the care that they need, and eventually they'll be able to come out of the restraints probably once they're more calm.